Black Maternal Health Week is here. From April 11th through April 17th, Black Mamas Matter Alliance invites you to join us and our partners around the world for the 2026 Black Maternal Health Week campaign. 2026 is a significant year for BMMA as we mark 10 years of establishing the global Black maternal health movement. We have worked alongside Black mamas, families, birth workers, advocates, researchers, and organizers to sound the alarm of the rising maternal mortality rates, confront inequities in maternity care, and lift up community-driven solutions rooted in birth and reproductive justice. This year's BMHW26 theme is Rooted in Justice and Joy. It honors the imperative leadership of Black-led perinatal, maternal, and reproductive health organizations that continue to cultivate healing and transformation across communities. We carry the full truth of what systemic oppression and reproductive injustice have meant for Black mamas and birthing people. And in that truth, we root ourselves in justice, restoration, and joy. Not as promises for someday, but as what this movement demands today. Throughout the week, join us for virtual conversations, in-person gatherings, wellness-centered spaces, policy engagement, and community celebrations that reflect the full spectrum of Black maternal health. Black Maternal Health Week is more than a moment. It is a declaration that Black mamas deserve to thrive. Take a look at what we have in store this year. Join us by signing up for our newsletter at blackmamasmatter.org/connect. Follow BMMA and our alliance partners across social media and be sure to join the conversation using the official campaign hashtag BMHW26.
Good afternoon and welcome everyone. My name is Angela Doinsawa Aina and I'm the Executive Director of Black Mamas Matter Alliance, or simply BMMA. I am so delighted to be here with you all and to have you all joining us today for our Black Maternal Health Week 2026 Virtual Pep Rally. We're going to hear from partners in our alliance, from Black maternal health advocates, birth justice leaders, so many wonderful people who are doing the necessary work to combat our challenges around maternal and infant mortality, not only in this country, but are doing excellent work to even connect it with global stakeholders and global partners who are also working on these very issues. 2026 marks 10 years for BMMA establishing the global Black maternal health movement. This year of Black Maternal Health Week is rooted in justice and joy. Today, we are joined by so many of our partners across the nation who are going to give us a sneak peek of what's to come for the rest of this week of Black Maternal Health Week. I also want to lift up our sponsors for this year's Black Maternal Health Week campaign. That is Pampers, Robert Wood Johnson Foundation, Baby Dove, Planned Parenthood of Greater America, California Healthcare Foundation, Hope for Georgia Moms, and ACOG, which is the American College of Obstetricians and Gynecologists. Now, we're going to hear from some of our partners.
Good afternoon. I'm Elizabeth Dawes, a proud co-founder of the Black Mamas Matter Alliance and current director of maternal and reproductive health at the Century Foundation, where we support the Black Maternal Health Federal Policy Collective. I'm honored to facilitate the collective, a group of phenomenal Black women experts who work together to lead the strategic advancement of Black maternal health through federal policy from inception to implementation. As you are all aware, we are at a critical moment where many of the policies being made are intentionally harmful to Black women and families, and where other policymaking erases or ignores us altogether. Injustice is the most visible it has been in the 21st century, but now is not the time to lose hope or to cave in. This is the time where we stand strong, where we demand justice from the current system while creating our own infrastructure of care. an infrastructure that is rooted in joy, abundance, and possibility. The theme of this Black Maternal Health Week is a powerful guide for how we will make it through this moment to the future. We must stay grounded in those things we know to be true, despite the gaslighting. We must center our love for Black people, to spite the hate. We must be fortified by the wisdom and strength of our ancestors, which they have gifted to us. And most of all, we must care for ourselves. Some of you have been in this work for Black mamas for 20 years or more. You know that the fight for justice is a marathon, not a sprint. And how we get to the finish line matters, because burnout is a tool of the opposition, but our collective joy is a shield. So push for meaningful policy, provide for our people, and protect your peace by any means necessary. That is how we will succeed in creating a world where Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. I wish you all a wonderful and fruitful Black Maternal Health Week.
Greetings from North Miami, Florida, in the county of Dade. This is the Birth Justice Bus, which we've just launched for Black Maternal Health Week. So I'm showing you the outside of the bus, and then I will show you the inside. This bus is the centerpiece of our mobile midwife clinic, where we are providing free midwife and doula care to every Black mama and every mama and family that needs us. Cortez. There's Cortez, our outreach and advocacy director. Say hi to the people. Happy Black Maternal Health Week.
Woo! Happy Black Maternal Health Week, everyone. I am so excited to introduce you all to the Birth Justice Bus. I want y'all to see what we got going on here. This is so amazing. So this is room number 1. Y'all see Miss Jessica? So y'all see what we got here, right? This is amazing. And we're going to keep going. We got the sink, we got everything. We have a restroom here. All right.
So we are providing midwife model of care as a part of this initiative. We've been providing this care for years in this community. And I'm blessed to have my sister, Jessica Roach, here from Columbus, Ohio, visiting Black midwives supporting each other. So we are excited to provide this model of care free to the community, to partner with other agencies in the community, and to make sure that every family that needs us has a midwife and a doula. We also provide wraparound care, diapers, formula, all kinds of baby items, mental health support, chiropractic care, acupuncture, nutrition, educational classes, and whatever our families need. So our bus has 2 exam rooms and a bathroom, a waiting room. We are out in the community at lots of different spaces. We were at the city of North Miami on Saturday. We'll be at Overtown, historically Black community, coming up. You can show them the other exam room, and we'll wrap this up. So we just want to say happy Black Maternal Health Week. Thank you for celebrating the launch of the Birth Justice Bus with us, and we'll see you soon. Blessings.
Well, apparently I was live, everybody. I'm so sorry. My name is Salima McNeil. I'm from the Ocean Family Center, and we are here at our maternal mental health conference here in Philadelphia, everybody. Please excuse all of our technical difficulties, but I just wanted to bring you to see what we've been working on with our Joy and Justice. As you can see, our maternal health summit. We currently have a speaker up there, and we were on this morning to further help our clients and the community understand what we are doing here at Ocean Family Center in Philadelphia with the elevated voices and empowering care for the community during Black Maternal Health Week. We had a community baby shower on Saturday that serviced over 200 people, and we are having our Bridgerton style brunch on Friday, in which most of you were at last year, and we are doing it again. So again, Black Maternal Health Week is kicked off, y'all. Joy and justice of it all with our graphic recorder and our people in the room. Hey. So thank you all so much for this time. I hope all of your Black Maternal Health Week endeavors go well, and I look forward to seeing you all soon. Bye.
Good afternoon, everyone. My name is Erica Freeman. I am the founder of Sisters in Loss, a community born out of grief, but rooted in healing, storytelling, and advocacy. I stand here today not as a leader, but as a mother who has experienced loss and as a woman who knows that too many Black women navigating pregnancy, birth, and postpartum are being without seen, heard, or protected. We all know the numbers, and behind those numbers are real stories, stories that are being dismissed, ignored, and left to grieve in silence. That is why Sisters in Loss exists. We create safe spaces where Black women can share their stories of pregnancy and infant loss and infertility diagnoses without shame. We train providers, support families, and advocate for a world where no one has to say, I went through this alone, because healing should never happen in isolation. In this Black Maternal Health Week, we're bringing our community together for something powerful. So tomorrow we're hosting a Black Maternal Health Week, really a space for storytelling, education, and collective take care in Washington, D.C. If you're in the D.C. area or the DMV, we're going to center justice and joy and really honor the babies that we've lost, that we carry in our hearts, and really the futures that we are fighting for. So I invite you, whether you're a provider, policymaker, partner, or just a community member, to not just listen, but to act. Support Black mothers, believe Black women, invest in all of the community-based care of these amazing organizations and partners that you'll hear from today. And most importantly, hold space for our stories, because when we break the silence, we save lives. If you want to know more information, you can follow us at sistersinloss.com about our event that's happening tomorrow in Washington, D.C. Thank you all.
Greetings, everyone. I don't know. Can you hear me or see me? I can't see anything. Can I get a thumbs up or something?
Okay, sorry, I had muted myself.
Happy Black Maternal and Child Health Week, everyone. My name is Michaela Berry Smith. I am the Director of Maternal and Child Health Initiatives at the Foundation for Black Women's Wellness here in Madison, Wisconsin. Currently, I am at the Cultivating Connections MCH conference hosted for the first time by UW-Madison, specifically by Dr. Jill Denson, who is also a partner of BMMA. We are just kicking off today and excited for all of the speakers and outbreaks. Here at the foundation, we are actually gearing up for our sixth annual Black Maternal and Child Health Summit, which will be in person this year and is really a local convening, bringing together birth workers, policymakers, and governmental workers to really push the needle. If any of you have kept up with some of Wisconsin's policies, we recently passed our postpartum Medicaid. And so we are looking to continue with that momentum with bringing paid family leave here to Wisconsin. And our summit will be on April 23rd and will be able to be seen live once we meet. And then we have our Saving Our Babies press conference, which will be May 5th. Although it's not in this week, it is in the spirit of Black maternal and child health, as our Saving Our Babies initiative is really the impetus to all of the maternal and child health services that we provide here at the foundation, and was a starter that we created with the community for direct services in 2018. And we just celebrated our 8th anniversary of creating the program and our 4th anniversary of direct services at the beginning of this month. And we are also celebrating being the first organization, Black-led, Black-owned organization to partner with a regional insurance, Quartz Insurance, to provide maternal and child health care services regionally to Quartz HMO members. So we are very busy. We have a lot of great events that we are a part of. In fact, our CEO will be live streamed later today on Facebook. So check out our Facebook and check out a lot of the messages that we have. And we hope to see some of you at our Black Women's Wellness Day in October. Thank you so much.
Technical difficulties, I swear, on my end. My apologies. I am Stakisa Berry, the founder and the executive director of the Georgia Black Doula Network. This year, we kicked off the Black Maternal Health Week, celebrating and honoring Black Doula Day, which was April 11th. And we did that with a series of events that were satellite throughout the state. We hosted a wellness seminar in Valdosta, Georgia, as well as, which is South Georgia, as well as another event very similar to it, community event, which was wellness centered in Albany, Georgia. And then we also did Spelman. We kicked off our film college tour, beginning with Spelman College here. That was for our documentary, Cradle in Culture, Reclaiming the Legacy of Black Doula Care. We are releasing that to the public this year. We was a project that we worked on in 2024, upwards in 2025. And so now we're releasing it, and we're on this college tour throughout the state of Georgia. So tonight we will actually be at Emory University. Our goal is to focus on pre-med and public health and nursing students to help give them some insight on the scope of practice of a doula, and just understanding how they show up and how they can complement the healthcare system. And so we'll also be at Albany State University tomorrow evening with that documentary. And our plan is to continue with that throughout the duration of the year. And so this week specifically, we are focused greatly on amplifying the work of doulas within the maternal ecosystem, healthcare ecosystem. And so I'm gonna close out with that. I think I took up enough time with all my technical glitches, but I just want to wish everyone a joyful Black Maternal Health Week.
Good afternoon, everyone. My name is Dr. Anastasia Harris, and I am the founder and executive director of the Perinatal Health Equity Initiative. We are based in East Orange, New Jersey, and we are on a mission to redesign reproductive care for Black mamas and birthing people and families in New Jersey. And our work combines clinically rooted education, direct clinical care, and community programming, policy and advocacy all under one roof in our Lieutenant Tamisha Dickey Center, which is named after a fallen East Orange police officer. We are excited to participate in Black Maternal Health Week for now our 8th year. And I'm going to just briefly share our schedule for the week. You can find the link to all of our events on our Instagram page, which is at perinatal_equity, or you can go directly to our website, which is www.perinatalequity.org. We have a combination of in-person and virtual events. So today we have 2 events, one that is actually going on right now, which is our Rooted in Joy webinar, which is being held by Julene, one of our clinical directors, which is on centering maternal wellness across complex fertility journeys. We also will have a State of the Union address for Black maternal health in New Jersey. We are a state who has a rate that is twice that of national average. Black women here are 7 to 8 times more likely to die from a pregnancy complication. And despite hundreds of millions of dollars spent 8 years later, that statistic is still true. Progress that excludes Black women is not progress, and we are calling that out today at our webinar in combination with a coalition of other Black orgs in our state. We also have another webinar called Rooted in Justice, which is going to be on keeping families safe in the hospital, as well as how to navigate child welfare systems. We also will be including lactation into our work, and so we will have a live webinar on the 15th being held by our lactation team. That is at 12 p.m. In person, we will be hosting a mutual aid day on April 16th, and so this is a day where families can just come in, pick up needed items for themselves and for their babies to make sure mamas have access to what they need. And then we wrap up with a financial planning webinar on April 17th, which is focused on financial empowerment, stability, and building wealth. I also am very excited to announce, in partnership with Black Mamas Matter Alliance, we will be hosting the first Black Preeclampsia Awareness Day, date to be announced and coming up soon. So if you are interested in preeclampsia and cardiovascular awareness, please stay tuned for that update. And I thank you all for your time. Hope you all have an amazing week.
Hi, everyone. I'm Tony Junius, the Communication and Development Specialist at Mama Toto Village. And so we are a DC-based nonprofit, and we are committed to supporting Black women and families throughout their perinatal journeys and beyond. And so we've been celebrating Black maternal health all week. So on the 11th, we kicked off our inaugural 5K walk at the National Harbor. We had over 200 walkers, and all of this is to kick off our campaign, Black Maternal Health is Everyone's Business. And so this week you can catch us in person in DC all week. So on the 15th, we are tabling at Community Connections Vendor Day at DC Superior Court. On the 17th, we are tabling at Black Maternal Health Fair at Howard University Hospital. And the 18th, we have a tabling event and speaking engagement at Black Moms Fair at Bowie State University. And we're closing out Black Maternal Health Week at our inaugural soiree at Eaton, DC. And so if you can join us in person, it's going to be a very fun evening. We already got our outfits together. It's going to be full of community culture and a way to get support for Black maternal health from all the important people in the room. There's going to be music, drinks, dancing, and of course, a silent auction. And if you're out of town or you can't make it, you can still be a part of the silent auction starting on the 11th. So you can still bid now. Just go to mamatotovillage.org/BMHW, and it has all the info for all of our events. So we hope y'all can come through and see us, and we just love the support. Thank you.
Hello, everyone. My name is Inas Khalida Mahdi. I am the founder of Nzinga Maternal Health and Somali Restoration. Together at the two organizations, a lot of our focus centers on trauma-informed care and survivor justice in terms of maternal health care. We come together to focus our trainings on survivors, how survivors are better able to restore their sense of bodily autonomy, rebuild trust in ourselves, especially in the high pressure settings that might echo something similar to past assault or abuse. We offer learning circles and learning spaces that go beyond single events, really thinking about ongoing opportunities for survivor moms to practice grounding, consent, and self-advocacy in community with others who understand. Also through Nzinga, we work with organizations to provide evaluation, training, and technical assistance that supports improving outcomes for Black mamas and birthing people from the system perspective. We're looking at culture, protocols, data, really to see how we can better address that unaddressed sexual trauma that can live inside of hospitals and health systems. There's something here for survivors and providers. This week, we are offering a webinar on Wednesday. We're calling Cultivating Consent Confidence, Strategies for Survivors. And it's a space for survivors to help reclaim agency and learn concrete trauma-informed consent strategies to navigate those pressurized scenarios. For providers, there are lots that you can also draw from this webinar. How do we support survivors in different ways? How do we make sure that our care is not loaded with some internalized sexual trauma and abuse? So if you are a doula, a clinician, a provider, a mom who wants to know how to better navigate these systems, please join us on Wednesday for Cultivating Consent Confidence. We'll talk more about our offerings through our cohort practices and how we can better support organizations as they seek to address sexual trauma and improve their trauma responsive care. Thank you.
BMMA's work is year-round, and this community is at the heart of it. Our collective commitment to centering the voices, scholarship, lived experience, and community-led solutions of Black mamas and birthing people is the heart of our alliance. You've heard from some of our outstanding partners so far, and there's more to come. As an alliance, our impact is felt globally through mission alignment, shared action, collaborative programming, convenings, and strategy development. It is imperative now more than ever that we continue to build community, organize, collaborate, and strengthen our partnerships. This is what this movement requires of all of us. We opened Black Maternal Health Week 26 this past Saturday, April 11th, the International Day for Maternal Health and Rights, and Black Doula Day, honoring the leadership of Black doulas and birth workers. We held our annual walk and community fair, bringing together Black mamas, families, advocates, and community members for a day of movement, joy, and collective action. We also held a virtual global convening, Black Maternal Health Across Regions. This conversation marked the International Day for Maternal Health and Rights, bringing together voices from across regions to advance Black maternal health and birth justice worldwide. Throughout the rest of the week, BMMA and our Black-led partners are leading digital activations, policy engagement, educational programming, healing spaces, and community gatherings across the country. This Wednesday, April 15th, BMMA is hosting our Black Maternal Health Professionals Networking event here in Atlanta, Georgia. This will be a dedicated space for Black maternal health professionals to connect, build relationships, and strengthen the workforce advancing this movement. Register at bit.ly/BMHW26net. On Thursday, April 16th, we have Beyond the Binary, Black Trans Family Building in a World Not Built for Us. This will be a virtual conversation centering the experiences of Black trans and gender expansive people, navigating family building and reproductive care. Join at bit.ly/BTFB26. Finally, on Friday, April 17th, we'll have our Community Remembrance and Healing Vigil here in Atlanta, Georgia. We close the week by holding space to honor and remember those we have lost and to ground ourselves in the healing and collective care that sustains this movement. Join us at bit.ly/BMHVIG. Local events and activations led by the Alliance partners are listed on the Black Maternal Health Week 26 local events page at our blackmaternalhealthweek.com/events website. That's blkmaternalhealthweek.com/events as they are announced. Stay connected, follow BMMA and our Alliance partners on social media, sign up for our e-newsletter at blackmamasmatter.org/connect, and stay engaged beyond this week. Finally, to support BMMA and help ensure our work and impact continues, please consider giving by using bit.ly/BMHGive. Every contribution you make fuels this movement. Thank you and have a great Black Maternal Health Week.
Woo! Welcome, welcome, welcome. LA is bright and sunny, and we are glad to be here for Black Maternal Health Week 2026. We are rooted in joy and justice. My name is Audra Jones. I am the Birth Equity Unit Chief with LA County Department of Public Health. I also direct our African American Infant and Maternal Mortality Prevention Initiative in LA County. We are so excited. We kicked off our events on Saturday, April the 11th, with the Community Resource Fair and Baby Shower in Los Angeles, the South LA region, and Antelope Valley. On yesterday, we had an amazing Community Resource Fair and Baby Shower in the San Gabriel Valley. Today, we'll be joining Black Mamas, Black Women for Wellness in their journaling session for mothers. And so we're excited to partner with numerous organizations throughout LA County. Our goal and journey is to bring community and government together in a partnership to reduce the unacceptably high rates of Black infant and maternal mortality in our county and beyond. We also are excited to include our fathers in the engagement. You can find more about our programs and services and partnerships at www.blackinfantsandfamilies.org. You can also follow us on social media, Instagram, Black Infants and Families LA, and Facebook at Black Infants and Families Los Angeles. For more information, check the website out and it will have a list of all of our programs and services. We look forward to a great continued week. We have a community walk coming up. We have a self-care and awareness event through our San Fernando, Santa Clarita Valley AIM Community Action Team. And throughout the remainder of the week, we will be partnering and sharing more information all about what Black Mamas Matter Alliance is doing, as well as what we're doing in LA and our other partners in the work. So again, thank you. Join us in Los Angeles. Join the areas that are also providing these services. Our goal is to ensure that mamas and babies, birthing folks and their families have celebratory pregnancy and birthing and safe spaces for birthing, as well as the resources that are needed. So again, thank you, and thank you to our BMMA leadership for the great work. See you soon.
Hi, everyone. I'm Kelene Blake, the Executive Director of Black Mamas ATX. Our mission here at Black Mamas ATX is to ensure that Black mothers survive and thrive before, during, and after childbirth. We are based in Austin, Texas, and for Black Maternal Health Week, we are all in the Rooted and Justice and Joy theme. We are hosting our second annual Black Maternal Health Week Summit. It is hybrid, and you are able to join us from anywhere that you are celebrating Black Maternal Health Week this year. Our opening launch day was this Saturday, where we were rooted together here in Austin, Texas, celebrating building our alternative communities and doula work and spending time together, dancing, talking, building community with childcare food as it should be. We also, starting from today throughout the rest of Black Maternal Health Week, will be hosting online sessions. Those will be, today, the focus is rooted in mental health and wellness. And so we are talking to mental health experts throughout the day and speaking on that topic as it relates to Black maternal health. On Tuesday, we will be talking about being rooted in physical health and our bodies. And so we're talking lactation support, nutrition as healing, medications, all of these amazing topics. On Wednesday, we'll be talking about being rooted in advocacy and justice. And so community organizing, working towards making structural change and addressing these disparities. That's what we're talking about on Wednesday. Thursday, we're rooted in fatherhood, where we are going to be talking with fatherhood experts and talking with fathers about their role in Black maternal health. And finally, on Friday, we are rooted in joy. We are going to be having one online session that morning about being rooted in joy. And then we are closing with a party here in Austin, Texas at Rich's Art Gallery, where we will be building community together. So please join us, blackmamasatx.com, and on Instagram, blackmamas_ATX. And you can find tickets to the virtual conference there. Thank you.
Okay, can y'all hear me now? Okay. Hi, everyone. I'm Jasmine Williams. I'm the founding director of Blackberry. We are a reproductive justice and health equity organization located in Burien, Washington, serving Black families across Washington state and in the DFW area of Texas. This year, we are so happy to be spending Black Maternal Health Week in Texas, supporting and promoting the work that's being done in the area. We are also working on our own new programming that we will be launching for the Black community. We've been working closely with the Educated Birth to create a childbirth education self-paced course that will be free for Black families to be able to access and use. And then we also have our new partnership for our community donor milk program, where we are working with Leche. They are having folks that donate their milk, they freeze dry it. So now it's powdered form milk, easier for us to ship to make sure it gets to families all across Washington state. And then we will eventually be branching out for more of supporting folks within Texas. But it makes it so much easier for us to fill in the gap of families' access to donor milk. In addition, our tagline this year is curating public displays of Blackness. So you're going to be seeing more gatherings, more workshops, more community pantry pop-ups, which our community pantries are a great way for us to connect with local Black businesses. We buy from Black businesses and then provide those items to Black families at no cost. You'll also be seeing more digital content coming from us, just to make sure that we see ourselves represented in the birth content that's coming out. But to find out more information, you can always visit our website or follow us on our social media, and that's Blackberry, BLKBRY. Thank you all, and I hope that y'all have an amazing rest of Black Maternal Health Week.
Hey, everybody. Hey. Happy Black Maternal Health Week. I'm Jessica Roach. This is the crew, the Root family. We are Root, restoring our own through transformation, coming to you loud and clear from Miami, Florida, where we had an opportunity to be able to visit with our sister organization, Southern Birth Justice Network. And we made the decision together that we were going to utilize this opportunity in this week's Black Maternal Health Week after celebrating 9 years and entering into our 10th year with a whole lot of growth that's happening to find our rest. We believe that being rooted in justice and joy also means that we as birth workers, direct line folks, advocates, and the work that we do, that we get to honor ourselves as the Black mamas, as the Black aunties, the grandmamas, the grandfathers, the entire family. And then in order for us to be able to work and do the work that we do in community, as well as make sure that our community is well, we also need the space to be well. So while we have had an opportunity to support a couple of our organizations, sister organizations, a couple back in Ohio, and obviously here in Miami, Florida, we took this opportunity to say that we needed to spend that time with one another. We needed to spend our time and rest because we have a lot coming up, and we're looking forward to the next 10 years. So we are grateful for all of our folks that are part of BMMA and beyond. Looking forward to the new clinic, looking forward to the health and wellness program, looking forward to the Root Family Farm, looking forward to hopefully having some of you come and visit with us and spend time with us and host us as SBGN so graciously has as well. So we love you all. We appreciate you. And for everybody, happy Black Maternal Health Week.
Hey everyone, can you hear me? I'm good. I am so excited to be with you all. I am Kanika Harris, Executive Director of the National Association to Advance Black Birth. Jessica, I'm jealous. Jamara and all the crew in Miami, please get some sun and rest for me too. So the National Association to Advance Black Birth is a Black-led organization. We are committed to transforming Black maternal and infant health through community power, cultural wisdom, and systems change. We work at the intersections of justice, reproductive justice, and health equity to ensure that every Black birthing person, of course, thrives and that every baby is our baby. So we are most known, as you know, for our Black Birthing Bill of Rights, which is the foundational tool developed by NAB to affirm and protect the human rights of Black birthing people. And for the first time, we are just not talking about it. It's just not something you can download, but we are activating it. So we are doing trainings around the country, starting with California, doing trainings for nurses in hospitals. We are very excited about that. And then we also have our film, Listen to Me, which many of you on this call are screening for Black Maternal Health Week. We have over 15 screenings, including one in Geneva with the UN. So we're extremely excited about that. For everyone who has supported, our joy is really rooted in you all. It's rooted in the support that you give NAB. When you go and you buy and you download the Bill of Rights, when you use the Bill of Rights, and as you've been using the film, we are working on many other big things. And thank you so much. Have a good Black Maternal Health Week.
Can you all hear me? Happy Black Maternal Health Week. I am Jasmine Renchi. I am a maternal health initiative coordinator at IB Black Girl in Omaha, Nebraska. At IB Black Girl, we have trained over 73 community members to be birth workers. We are in our 5th cohort, which will end at the end of May. And at that time, we will have trained over 80 community members to be doulas. And we also have trained, cross-trained over about 35 to also be community health workers. This is our 3rd year participating in Black Maternal Health Week. Tomorrow we will be screening Listen to Me. We're very excited to offer that to our community. We also have a diaper and wipe drive going on this week to support moms and birthing folks in our community at our annual baby shower that will be held in October during Black Maternal Health Month. Which is when we recognize it here in Nebraska. Also, we will close out the celebration with our 3rd annual Heart, Soul, and Roll Community 5K Stroll. We're so excited about that. Again, thank you to BMMA and have a joyful week.
Greetings from California, everyone. My name is Dr. Saida Pepper-Wilson. I'm a licensed clinical psychologist. I'm a doula. I'm also a trainer, and I'm the founder and executive director of nonprofit Diversity Uplifts. Diversity Uplifts is a capacity building, training, and direct service nonprofit focused on the well-being of women, birthing people, children, and families by supporting communities impacted by historical trauma and health disparities, while also increasing the competence and cultural humility among providers and systems who serve them. I'm on a Black Maternal Health Week tour this week. I started this past weekend in Lancaster, Pennsylvania, to celebrate Black Maternal Health Week with the Diversifying Doulas Initiative led by Dr. Livingston, an OB in deep collaboration with midwives out there. Really incredible work. She runs a birth center that is staffed with over 40 midwives in practice and in tandem with doulas in this very amazing collaborative effort to provide really holistic care to the community. They just celebrated training 102 doulas. And in the culmination, we had a really powerful fireside chat, myself and Nakia Lawson, who's the lead doula trainer for DDI. In California, Sister Web, in partnership with San Francisco Human Rights Commission and other community partners, are going to be joining to bring forth a resolution to California for Black Maternal Health Week in a rally and a panel on April 15th. Then Thursday morning, I will be virtually with the San Joaquin County Black Maternal Health Symposium, speaking on actionable insights from the California Pregnancy Associated Mortality Review, so our MMRC. Really excited to lift up, practical solutions and, really minimize folks' fears of why women are dying, and really focusing on what solutions, like we all come together in these maternal mortality reviews for the sole purpose of identifying what could we do to have this never happen again. And we're going to be centering those conversations. Then I will join Stanford School of Medicine for maternal mental health focused conversation on clinical care and systems change and empowerment around Black maternal health at the Perinatal Potpourri Conference. Then on the final day of Black Maternal Health Week on April 17th, Frontline Doulas will be hosting a Medi-Cal doula benefit, which is our Medicaid in California, Justice in Action for Los Angeles County families. It'll be live streamed, and I'll share how you can connect with that. And finally, in a lot of joy, I will be dancing and networking and connecting with all my Bay Area birth worker sisters and leaders at the Birth Justice Prom, where they are calling it Bloom Where You Planted. They're going to have a prom royalty, and I'm so excited to dance to the final end of Black Maternal Health Week. So you can follow me at Dr. Saida Uplifts on Instagram and all the connected parts, Facebook, and also Diversity Uplifts as well. Thank you so much.
I hope you all feel so warm, touched, and most importantly, excited and ready to engage further in this year's Black Maternal Health Week campaign. You have heard from brilliance, from Black excellence, from our healers, our midwives, our doulas, physicians, nurses, lactation consultants, community health workers, public health practitioners, researchers, advocates, artists, mamas, right? Everyone who is doing this work within our communities across this nation and also connecting across the globe. So when you see terrible things online, when you see headlines that says the Black maternal health crisis, when you see things that just constantly uplifts negative stereotypes or negative narratives around what Black women are experiencing around motherhood, know that Black women are themselves at the front lines leading this work. And we are called the Black Maternal Health Movement. We are here. We are the solution. And that is what this week is about. We are rooted in justice and joy. And what you just got is just the tip of the iceberg today of what's happening across our nation. This is why we call this virtual rally Black Maternal Health in your neighborhood, because more than likely it's folks doing Black maternal health work. Like, we got reproductive justice organizations, birth justice organizations, great people, great nurses, great midwives, great healers, great practitioners right in our neighborhoods. And all it takes is to look up and find them. If you need a quick reference to find out more about the organizations that you heard from today, be sure to visit BMMA's website at blackmamasmatter.org/our-partners. That showcases a list of all of our partners across the nation. And then also for a lot of the Black-led organizations, perinatal organizations that you heard from today, utilize the hashtag BMHW26. More than likely, you're going to find them because a lot of their programs are already posted online and easy to access. You can continue to get engaged with all things Black Maternal Health Week by visiting the official Black Maternal Health Week page, blkmaternalhealthweek.com. please do sign up for our newsletter, especially if you want to continue to be engaged in Black maternal health work year round. And that's at blackmamasmatter.org/connect. And of course, like many organizations, support us and support the work. Feel free to become a recurring donor. Feel free to sign up to be a volunteer. We really do need everyone to join in this work of Black maternal health because, again, when we come together as a community, we really do affect change, not just for Black folks, but for everyone, because it really is possible for us to eliminate maternal mortality. And remember, more than 80% of maternal deaths are preventable. And right here, what you just saw today throughout today's virtual pep rally are just a number of the solutions that are helping to address this maternal health crisis in the United States. Again, follow Black Mamas Matter across all social media. We thank each and every one of you for joining us. I also want to lift up our sponsors, Pampers, Robert Wood Johnson Foundation, Baby Dove, Planned Parenthood Federation of America, California Healthcare Foundation, Hope for Georgia Moms, and the American College of Obstetricians and Gynecologists, or simply ACOG. Thank you so much for supporting us in putting on Black Maternal Health Week again this year in 2026. And I really do encourage each and every one of you to continue to join us year round. There is so much work to do. And also, I would be remiss if I didn't do a special shout out to all of BMMA staff and our volunteers that continue to make this week happen and all of our wonderful events that we put on for you to make Black Maternal Health Week happen. And then also for anyone who is in the state of Georgia, which is our birth home here at BMMA, know that we are doing the good and divine work to ensure that we continue to do Black maternal health advocacy and policy. We have upstanded our Georgia Black Maternal Health Task Force. So again, I ask you to join us in these efforts by signing up for our newsletter. Thank you, everyone, and happy Black Maternal Health Week. Have a good one.